Hey, I'm Mark Rosenberg. I'm a chiropractor, and for 35 years that I've been in practice, I've done things from a holistic standpoint to keep people healthy. And what I'm about to show you are some mechanical things that you could do to yourself, pressing on different points and little different exercises to help with breathing. This in no way can help make coronavirus go away, but some of the symptoms of coughing, of feeling like you're choking, even if you don't have it at this time and you're home sick, these techniques will help. I've been doing them in my office. I usually do them to patients. I also do them to myself, and I want to pass on to you, all my friends, some things that will make you feel more comfortable at this very difficult time for all of us. Okay, first, here you have your deltoid muscle, okay? And underneath it's a bone called the acromion process. Your bicep muscle attaches to both sides of this. If you press on that bone, it will be tender. Sometimes you can isolate it by going up and then going down. It's the bone that is right there that you can feel the muscles moving over. Dig on it. With my right hand, I will rotate my thumb clockwise. With my left hand, I'll do counterclockwise. And I massage it. It'll be tender, 45 seconds a minute. Okay, then I do the other side. I don't have to do that. You know what I mean. On a patient, I would do both at the same time. And this helps to disperse some of the tension. When people are coughing and choking, throwing up, we come forward. It all comes forward. So we want to open that up. So these points will help open up the shoulders. Next, there's a lot of tension in the neck that could be there from all kinds of respiratory issues. This here is the interclavicular notch, and I use my middle finger because it's the longest, and I push down. And it's sometimes you have a sensation like there's a pit from a fruit stuck in your throat. This will disperse the tension. So again, I'm not pushing into my throat. I'm pulling down on top of the sternum. Again, 45 seconds to a minute. Okay, then the last series of points. This here is your clavicle or your collarbone, and underneath that are your ribs. Ribs go like this. If you move down about an inch, you'll find a very tender spot there, and massage it. Okay, and again, I'm going to do one at a time. Somebody's on the table. I'm going to do both at the same time. So if you're in quarantine, you can work on each other. Okay, and what happens, that's a lung point as well. Okay, you can release those. So you have three things. You have the here, you have here, and you have here to open up. Now, one of the things I would teach in my Tai Chi class was to roll the shoulders back, and that opens up and stretches. You might hear tension in the muscles in the back, a little clicking. Don't worry about it. The more you do this, the more it goes away. Okay, then you bring your shoulders up to your ears and drop them. So that's me. Do that 3 or 4 times. So that's me telling my muscles to tighten up, and that's me directing my muscles to let go. When we get stressed out, when we get tension build up in our body, it builds up insidiously, little by little by little by little. And what happens is we're, all of a sudden people walking down the street and they have their shoulders like this, or sometimes one shoulder up, then it leads to a stiff neck, and then the muscles interact, and then you have to cough. And so it's a whole series of things. These are mechanical techniques to try and break up some of the tension here. So as you do this and let go, you're resetting yourself, kind of like resetting the fuses. Okay, so that's today's video. That'll help. I'm going to do a lot more to help in this time. And make sure you're washing your hands and self-isolating and being careful out there. Okay, speak to you soon.